Good afternoon, everyone, and thank you for joining us today, this Monday, October the 4th. I'd like to welcome Dr. Elizabeth Richardson, our Medical Officer of Health, and Jason Thorne, the city's Emergency Operations Center Director. I'd like to begin by reminding everyone that the proof of vaccination policy is a provincial requirement, and that requires compliance. The pandemic has altered how we go about our day-to-day life, and we all want this pandemic to end and to return to things we enjoy doing. So the proof of vaccination initiative put in place by the provincial government is another step in keeping the community safe and COVID-19 transmission low. So thank you to the many businesses that are implementing the proof of vaccination policy. We hope that all will. And for those accessing those businesses, remember that they are run by family members, a friend, or a neighbor. And my hope is that we give one another a bit of grace as we move through these transitions as businesses work to implement the new protocols. So be patient. Be kind to one another. Don't blame it on the person standing at the door asking for their proof of vaccination. That is their job. They're required to do so, so don't give them a hard time. Ending this pandemic will require everyone to work together, and in that light, we are very appreciative of the Hamilton Public Library for having laminated approximately 23,000 vaccine receipts over the past 2 weeks. I'd like to extend a sincere thank you to our partners at the HPL for assisting the community in printing and laminating these vaccines. Ensuring that everyone in Hamilton has access to this information is also an important area, and that proof of vaccination is a policy that is in place and everyone needs to provide it, and certainly the library is helping do that. So thank you, Public Library, for your effort. You've been a great partner throughout this entire pandemic. Now I'm going to turn it over to our city's Emergency Operations Center Director, Jason Thorne. Jason?
Thank you, Mr. Mayor. And I'm going to begin this afternoon with an update on the city's recreational programs. So the fall session for registered recreation programs does start today. So just a reminder to everyone that the provincial proof of vaccination requirement does apply to our rec centers and our arenas. So that means that to access one of the rec centers or arenas, you will need to provide your proof of vaccination as well as your identification. For city staff who are doing the screening, they are doing a visual verification only. So they are not keeping the health records tied to your membership or anything like that. So you will need to show your vaccine verification identification each time you enter and re-enter any of our rec centers or arenas. Under the provincial regulations, there are a few exceptions permitted for our recreation facilities. These include children under the age of 12, participants in an organized sport under the age of 18, individuals with a medical exemption and the supporting documentation required from a physician or a nurse, as well as individuals who are just accessing the facility to use the public washroom, to pass through the facility to an outdoor space, to make a purchase such as a membership purchase at the counter, or if they're entering one of these facilities to access one of the social services. There are full details about the recreation programs as well as the vaccine requirements available on the city website. As the mayor mentioned, proof of vaccination, of course, continues to be required at a number of our business establishments in the city as well. And as the mayor did, I'd like to thank the hundreds of businesses across the city who have successfully instituted the new vaccine verification procedures. Since the provincial vaccine passport regulations came into force on September the 22nd, city bylaw officers have been undertaking progressive enforcement, providing education to both businesses as well as to patrons about the proof of vaccination requirements. As we move now into the second week of these provincial rules being in effect, officers will be continuing an educational approach in some circumstances, but will also be issuing fines ranging from $750 to $1,000 to those businesses that are flagrantly disregarding the rules. Overall, this past week, we issued 31 COVID-related charges against 13 different businesses. And this past weekend, officers also visited a number of businesses explicitly for the purpose of enforcing the proof of vaccination requirements. This did result in one charge, which is the first charge in the city against a business for violating the provincial vaccine verification requirements. Enforcement activities continue for social gatherings as well. In particular, we're continuing to place a high priority emphasis on some of the ongoing concerns related to student parties. While police led the enforcement response this past weekend for the so-called fake McMaster homecoming event, bylaw officers have in the past, and they will be continuing to do so, to enforce and respond when there are illegal gatherings, illegal house parties, and continuing to issue orders and charges when that happens. So with that, I will turn things over to Dr. Richardson.
Thanks very much, Jason, and good afternoon, everybody. Just going to go over some trends and talk about a few other issues today as per usual. So overall, our case activity does continue to be at a higher rate. We did experience a slight decrease again last week, but a slight increase last week, and activity does appear to be decreasing slightly again. So we're at 24,656 cases in total, a net change of 62 cases from Friday. And the highest rates do continue to be in those up to 59 years of age. Our 7-day moving average of cases is at 36, and the weekly incidence is sitting at 42. Our most recently updated weekly reproductive number is sitting at 0.86. We're very glad to see that the number of daily new hospitalizations is staying low at this time. There's currently less than 1 new hospital admission each day on average. That had gone up into the 4 to 5 range. The average number of deaths occurring per day also remains low. And our percent positivity, although it too is trending downwards, it's still at 3.1%, so still something that we would like to see come lower. Today, there are currently 20 active outbreaks and 4 new outbreaks were reported today. On the vaccine front, we do continue to make progress. We're at 831,578 doses distributed locally. And this brings us to 83.5% of Hamiltonians who were born in 2009 or earlier, having had at least their first dose to date, and nearly 78% are fully vaccinated. You did see last week the modeling from Ontario's COVID-19 Science Advisory Table, which showed what our local scars and modeling had been illustrating now. And that's that we're at a fragile phase in the pandemic. We've got really good things that are happening in terms of people are maintaining their public health measures and vaccination coverage rates are going up. But Delta is still out there. It is a very infectious virus or variant of the virus in particular. And of course, as we're all coming back into the indoor environments, it creates more and more opportunities for transmission to happen. So when we're thinking about the things that are upcoming, like Thanksgiving festivities, we do want to make sure that as people are thinking about getting together with their loved ones, they're also thinking through how they want to approach it from a COVID-19 perspective. So as per usual, if you're looking at bringing people together at home in that kind of indoor setting, strongly encourage people who are not well to be staying at home and not going out to join any of these gatherings, but rather, create a forum where they can join online, join remotely somehow. Now, the weather is looking mild this weekend. We'll see if the rain holds off, but it looks better for Monday. So it's a great opportunity to take things outdoors. And so take advantage of it, hold the occasion outside or go out for a walk, a hike. All of those things are great ways to go outdoors and yet still be together and benefit, of course, from that lower risk of transmission. If you are gathering indoors and you have a mix of vaccinated and unvaccinated or partially vaccinated individuals indoors, do think about, asking guests about their symptoms. I think at this point in our evolution with COVID-19, we're all pretty comfortable with asking one another those things. And if need be, do ask them to mask while they're indoors. And that's particularly the case when you're eating or drinking. As we've talked about, those are activities where we do see higher risks. And especially, of course, as well, if you do have somebody who is vulnerable in the family, somebody who's older, immune suppressed, those sorts of risks and risks of severe outcomes do continue to increase with age and if they have any of those sorts of vulnerability. So particularly be cautious in those sorts of circumstances. Those, as I said before, those public health measures, in addition to vaccination, are very effective at reducing the spread indoors. And so make sure that those are taken into consideration. As you've seen, just looking at the latest update on the statistics too, in terms of the risks of severe outcomes for those who are unvaccinated versus vaccinated, you'll have seen at the most recent COVID Science Advisory Table briefing that unvaccinated people have a 7-fold higher risk of symptomatic COVID-19, a 25-fold higher risk of being in the hospital and a 60-fold higher risk of being in the ICU compared to somebody who is fully vaccinated. You'll start to see from us as well some more information about long COVID or post-COVID-19 syndrome and just what the risks are there. And what we're seeing so far from that information is that the risk for long COVID is reduced in those who are vaccinated, both because they're less likely to become infected, but also it does appear that they have a lower risk of having long COVID as well, even if they are infected. So alongside our partners from across the healthcare system and our local community organizations, we are staying focused on our last mile strategy, going to more places where people are and leveraging our strong relationships with community organizations. Following the proof of vaccination policy that came out, as we've been talking about, we did see an encouraging boost in our local vaccine coverage rates. The daily average of total vaccine doses administered increased by nearly 25% between September 21st when we were at 1,404 doses per day and September 27th when we were up to 1,739 doses a day. And this was mostly an increase in second doses during that phase, but we did continue to see good rates of first doses being administered. After that peak, it's now declined again to about the rate it was at about 1,400 doses per day. So over that period, it's interesting to note as well that we saw amongst all of our clinic sites, we had 3 days of administering over 2,000 daily doses. And the last time we saw that was actually back in July. So very glad to have seen people coming out. So we are, of course, with this last mile strategy, working to bring the vaccine to all those that haven't had it yet, and particularly focusing on areas that are disproportionately impacted by COVID-19. So you see us out and about in apartment buildings and other sites. We've been offering to higher risk workplaces to hold on-site workplace vaccination clinics. And of course, our mobile clinics are being held all through the community. We have upcoming ones scheduled at Treehouse Foods or Edie Smith, as some of us may call it, in Winona. A return to Victoria Park Community Homes, at Pinky Lewis, at the Centre on Barton, at various Hamilton Public Library branches and rec centers. We were very happy to see that when we went out to Terra Greenhouses over the weekend, we had over 160 vaccine doses administered on Saturday and Sunday, and over 100 doses administered at the Hamilton Public Health Mountain Clinic yesterday. So even though the last mile is always the most difficult, each first dose that we give means another community member has made the decision to move from being on the fence to rolling up their sleeve to protect themselves, their loved ones, and the community. And so through these things, these vaccinations, through the public health measures, we can decrease the impact of this fourth wave as we're seeing happen. And we can also protect those who cannot be vaccinated, like those kids that are under 12 and those who are immunocompromised or have other medical exemptions. So very important as we're going into this fall season. And as always, you can find the information on hamilton.ca/getyourvaccine. Back to you, Mr. Mayor.
Thank you very much, Jason and Elizabeth, for all of that information. And as Dr. Elizabeth points out, there are many more locations now where you can get vaccine, 28 upcoming mobile pop-up clinics, 2 post-secondary clinics, 2 primary care-led clinics, as well as 100 plus pharmacies. So there is every reason for you to very conveniently get the vaccine should you choose to go down that road. And we certainly encourage you to choose to go down that road. So everything we're doing is to protect residents and beat this virus. And everyone has a role to play to do that. And we thank all of those that are continuing to step up to get the vaccine. It is in their interest. It's in the interest of their family. And certainly it's in the interest of our community getting back to all the things that we want to do without restrictions. And so even though there's restrictions now, the more and more people get vaccinated, the less and less we're going to see those restrictions and being able to get back to some sense of normalcy. So thank you for all of your good work out there. And certainly let me thank all of our healthcare workers, whether it's in the pharmacies or all the other public health-led clinics, continue to do an outstanding job of getting the vaccine a hopefully anxiety-free process, and being friendly and courteous and efficient has been the order of the day of all of the experiences I've heard about for people that have gotten their vaccine, and that effort continues, and we thank them for putting that effort in to make it so. On that note, Jasmine, I'm going to turn it over to you for any media questions. Jasmine.
Great. Thank you, Mr. Mayor. We have 6 media joining us today. And as usual, we will start with 1 question and 1 follow-up for everyone. Our first question will go to Lisa Polesky from CHML. Lisa, you can go ahead.
Hi, thanks very much. I hope you can hear me okay. So some restaurants have been kind of vocal about being opposed to the vaccine certificate policy ever since it went into effect. Despite that, there's just the one charge listed on the city's website right now. We had the owner of one business on James Street North on CHML on one of our talk shows last week saying, you know, how she refuses to abide by this policy and is just outright refusing. So what is the city doing with these particular businesses that are being really outspoken about the fact that they refuse to follow the policy no matter what?
Jason could probably start with that. And, you know, I would say I want to thank those businesses for being so open about it, because it certainly makes our job a lot easier in terms of law enforcement and MLE, or the bylaw enforcement, and a very unfortunate attitude that they're bringing to this whole process. And I don't think it's going to be in their interest to hold on to that theory, because 80% or more of the population supports getting vaccinated and vaccine verification. So from a business perspective, absolutely makes no sense for them to cut off 80% of their potential customers. So I'm not sure they're thinking it through appropriately, but I think Jason will outline for you, what our next steps are with these individuals.
Yes, thank you, Mr. Mayor. And absolutely, when we see that kind of flagrant disregard for the regulations, that's when we're going to be proceeding to charges and orders. As I said, we do, whenever the new regulations have been brought into place, we have tended to start with what we call our progressive enforcement and making sure that there is some education provided. But again, if we see that kind of flagrant disregard, that's when we'll be issuing charges. And as I said, we did have our first one this weekend. I do expect some more in the coming days based on some of the other enforcement activities we were doing over the weekend. And where we also monitor social media and some of those statements that are made. And yes, those do become places that we target for some of our proactive enforcement. Absolutely.
Okay, thanks very much. And I guess this second question, I think it would be for you, Jason, but it may be for Mr. Mayor and Dr. Richardson as well. It's about the rate of vaccination among city employees. So we've heard that 78% have disclosed their status, and of those 93% are fully vaccinated. What about that remaining 22%? What is the city kind of doing to reach those people, and why do you think maybe they're not kind of getting on board with this city policy?
I'll start. I think I've said previously that, the city staff is kind of a microcosm of the city at large. There are people from all walks of life, working for the city of Hamilton, and I think it'd be a little rich to expect that there isn't some resistance in that space as well. And we'll continue to work through that process as we go forward. The educational process has begun. And that will hopefully lead them to make a decision around getting a first dose. And if that doesn't occur, then they're required to do bi-weekly or weekly, twice weekly testing going forward before they can actually come back to work. So I'll let Jason and Dr. Elizabeth fill in any blanks there. But
yeah, so we are starting to do. We are rolling out the education sessions, and each day we have more and more of city staff who are responding. I can say one of the challenging areas to reach within the organization, as you can imagine, we do have a number of what we call part-time casual staff who may not be currently scheduled for shifts. Some of the part-time casual staff, we can't reach out through email, so we are doing some individual phone outs to some of those staff. So some of those areas are taking a bit longer to get the message out to staff and get them into compliance with the policy. It's encouraging that we did see an uptick from when we first reported on our results in middle of September to where we were as of the end of last week. And we are being very clear with staff that they now have until November 1st to come into full compliance to have their second dose. And we are also developing our testing regime for those who are not vaccinated by that deadline.
And maybe I'll just add in, Jason, just to follow on from what you said. Mr. Mayor, you mentioned about our staff are likely to be very similar to all those in the community, and there'll be those for whom more information would really be helpful to them understanding context more so. And so really encouraging people to reach out to their family physician or their pharmacist, whoever it is that they feel is trusted, a faith leader, whoever they feel can give them good information. And they can also, of course, call our hotlines and talk through these decisions, or just go to the clinic. Our clinic staff, the people that are from across the health system that are staffing these clinics, can also talk to them about any concerns they might have around vaccines and their particular situation. So very glad to be there to help people support them through that decision making.
Can I also add that, some of the significant resistance, or at least from the leadership of the Amalgamated Transit Union, forms a significant part of the folks that are not taking part in the vaccination verification. I note with interest that the union representing the Toronto Transit Commission has since the last few days reversed their decision and are now fully supporting the vaccine verification process. And we certainly hope and expect that ongoing dialogue will happen with ATU and as has been occurring with all of our unions to encourage them to support the vaccination process. And I'm hoping that the ATU will come around to doing the same.
Great, thank you everyone. We'll go next to Bobby from CBC Hamilton. Bobby, you can go ahead.
Thank you very much. I hope everyone had a good weekend. My first question is for Dr. Richardson. Let's just rewind to Saturday. Thousands of people near McMaster, unmasked. They weren't distancing. I guess they were outside for a good portion of the day, but from what I understand, there were lots of house parties. From a public health perspective, what are your thoughts on what took place? What concerns might you have about that?
Thanks very much, Bobby. And I'm sure Jason and the mayor probably have some thoughts about this one too. But from a public health standpoint, it is absolutely disappointing to see crowds of that size and very little or no observance of public health measures like physical distancing, masking, those sorts of things. So we fully recognize that young people have been profoundly impacted, of course, by this pandemic. And, whether it's from an academic perspective or a social perspective, it's been tough. Let's not kid ourselves, but absolutely that doesn't excuse the kinds of things that went on when it comes to considering where we're at in this pandemic and exactly what the challenges are. They are definitely putting themselves at risk, putting the community at risk as a whole. And this is absolutely the kind of situations where you can see increased COVID-19 transmission, especially with this Delta variant and having it spread through further. So it is irresponsible and in many ways it's quite selfish in terms of that sort of behavior. So really, hoping that these sorts of things are not going to continue on, but having some really sober second thought, if you will, around this. And particularly as we come up to this next Thanksgiving weekend and where people are going to be at and what they're doing, thinking about what can we do differently as we go forward. Because otherwise we really are at risk of a sort of 1-2 punch with these 2 weekends back to back and having increased cases and trends.
Thank you very much. And my second question, I look at the active city outbreaks. The website says there are 20. More than half of those appear to be related to schools. So I'm wondering what you make of those numbers, if there are any concerns there.
Well, you've absolutely got it right, Bobby. More than half of those are schools and daycare centers, both of those where people can't be vaccinated particularly, and of course are indoors for prolonged periods of time. So this is what we expected, of course, is that we would see outbreaks in schools, in daycares, because they absolutely reflect what's going on in the community. So we, most of these outbreaks though do tend to be small because, we've got pretty good vaccination rates out there. We'd like to see them go up even higher, and kudos to our 12 to 17-year-olds. They have gotten higher and higher vaccination rates and surpassed that worrisome group that's more in the 19 to 35 sort of age range. So we are definitely seeing some good progress there. we are looking at each one of these outbreaks. And if there's anything that we see that's of concern, we do this in conjunction with the school boards. We learn from them. And at this stage, don't really have anything new that we're thinking needs to be added. We know the school boards did add some additional measures over and above the provincial controls that we had recommended for them. So we'll just continue to monitor as we go forwards. But we do, this is a setting where we want to keep a close eye and make sure we're doing as much as we can to limit transmission, because we need those kids in school.
Thank you.
Thanks, Dr. Richardson. We'll go next to Emily Taylor from CHCH. Emily, you can go ahead.
Hi, everyone. I wanted to ask about McMaster's street party as well. Dr. Richardson, are you concerned at all this could become a sort of super spreader event? And is there any look towards maybe increased testing or any sort of monitoring of McMaster students now who are going to then turn around and go back to these full classes on campus?
Thanks very much, Emily. These are the kinds of events that we do get quite concerned about, where we have, large numbers of people gathering way over the gathering limits that are, generally recommended, doing the sorts of things that we are concerned about. We know that alcohol mixed with these kinds of events also makes a difference. It impairs our judgment, of course, and so increases the risk for risky behaviors like not masking, all of those sorts of things. So it is of concern to us from that perspective. We'll continue to monitor. The university is, of course, in transition with its own vaccine policy and its own regime. And so they're very aware and they're very concerned as well. And so we're hopeful that we won't see anything from this, but really are concerned about these kinds of events and what they could mean for us.
Definitely. And then looking at the restaurant outbreaks through restaurant enforcement with this vaccine passport, Jason Thorne, you had mentioned the 31 COVID charges over 13 different businesses. I was wondering if you're able to just go into more detail about those, or any of those looking at potential fines coming up, or if you're able to detail more about that.
Yeah, so that those 31 that I mentioned were COVID-related charges of different types. What we're still seeing a fair bit of is what I would call violations under some of the older long-standing regulations. So we do continue to see most of the charges that were issued over the past few days really relate still to those masking requirements, physical distancing requirements, posting the appropriate signage. We do continue to hear from some businesses a little bit of confusion that some had thought that when the passport requirement came in, that some of those pre-existing regulations were no longer applicable. So we are making sure that we're clear with businesses that no, you still have to do all of those things that you've been doing for the past several months, and that the passport requirement is above and beyond those. So those are some of the types of charges that we're seeing. Again, as I said, we did also, in addition to that, have our first charge for the violation of the vaccine verification requirement this weekend. And I do anticipate a couple more in the coming days based on some of the weekend's enforcement activities. And that is also going to be an additional area we're going to be doing some dedicated enforcement in the days and weeks to come.
Thank you.
Thank you, Jason. We'll go next to Fallon Hewitt from the Hamilton Spectator. Fallon, you can go ahead.
Hi, thanks so much for taking my questions. My first question is for Jason. With the situation at Empire Burger, obviously that's the first business in Hamilton to be charged with the vaccine verification related violations. But they are the first business. So what can you sort of tell us about what exactly was going on at the restaurant and what led them to being charged? I understand the progressive enforcement and the education that's provided, but could you give us any more sort of insight into what led them to being the first business charged?
So I don't have the specifics in terms of what sort of actions were actually taken on site in that particular facility. I will say the way we've been approaching those new passport requirements has been a few different things. In some cases, we are responding to complaints. Much of it right now is proactive. We are monitoring as well where there are businesses that are very openly saying they won't be complying with those regulations, and those do become priority for some of our proactive enforcement. And then what officers are looking for when they attend at the business is whether or not those businesses do have in place the required procedures to make sure they're both checking for the vaccine verification and checking for identification before allowing any patrons to sit at the restaurants. So I don't have the specifics in terms of what exactly the approach was taken at that particular business, but I will say we're using a couple of different enforcement techniques and approaches to make sure that we are, again, responding to complaints in some cases. But in the case of these new passport regulations, we are doing quite a bit of proactive enforcement as well.
Thank you. And for my follow-up question, a number of the businesses that were charged over the last week are hair salons and like nail studios and so on. And both of those businesses don't require vaccine verification. Is the city doing anything different when it comes to enforcement of these kinds of businesses, especially with the noted lack of masking based on the charges? Like, could you tell us any more about the enforcement of those types of?
Yes, and it's an important point because, again, even though the passport requirements are only for certain types of establishments, that doesn't mean that we aren't still continuing to enforce the existing regulations against all the other types of businesses and establishments in the city. So yes, we are still going out to hair salons and nail salons and those types of facilities that still do have to be meeting the masking and physical distance requirements. So that's absolutely still part of the enforcement program. And yes, as you correctly noted, there were a few charges to those types of businesses placed over this past weekend.
Thanks, Jason. We'll go next to Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Thanks very much. My first question is for Jason. Regarding the MAC parties from over the weekend, were bylaw officers involved in any way in monitoring and enforcing? I know, police have said they have charged 7 people, but that seems quite low considering a gathering of 5,000 people would be 5,000 people not following laws at the moment.
Yeah, so we did have some bylaw officers there but in a supporting role. Like I said earlier, really since the beginning of the school year, we've been doing more concerted enforcement in and around some of the post-secondary institutions, focused on some complaints and proactive enforcement about house parties, and we have issued a number of charges with respect to those kinds of violations. For this past weekend, given the magnitude of the event and the potential for risk to the officers, lead enforcement was handed over to the Hamilton Police Service, so they were lead for the weekend, and they did issue, as was noted, a number of charges. So bylaw was in those types of situations, those types of major events, bylaw really is more there in a supporting role if they are needed by the police.
Thanks very much. So when you say risk to officers, you mean like bylaw took a step back to take the lead from police and didn't want to sort of antagonize the crowd? Is that what you mean by risk, or maybe I'm misunderstanding that?
Yeah, so we do let the police take the lead in those situations. So for example, what we have been doing since the beginning of the school year, where we do see house parties, we have been going up to those house parties and in some cases issuing charges. But just given the scale and magnitude of the event that was happening, that just wasn't possible for the officers to be able to move through the crowd to get to some of the individual house parties. So that's where the police really took the lead in terms of their enforcement approach.
Great, thanks, Jason. We'll go next to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my questions. My question is for Dr. Richardson. Dr. Richardson, the Ontario College of Family Physicians is showing that parents of younger children tend to be a little more hesitant at having them vaccinated. And it comes at the same time that provincial data has shown that less than half of eligible children who turn 12 this year are fully vaccinated. Considering that Hamilton often is a little bit below the provincial average, do you have a kind of an idea or a gauge on where Hamilton is at when it comes to the youngest kids, those who are, age 12 or 13, on how many of those we have fully vaccinated?
Thanks, Joanna. I'm just trying to recall. I don't think I have at my fingertips, although I know we sent some information out last week around vaccination status for those that are the 12 and 13-year-olds. Now, we go by birth year, the 2009, 2010 sort of cohort. So for the 2009 group, of course, not all of them have turned of the age of 12 yet. So that's where the age piece, it comes into the 11-12 piece. So we could probably go back and look at those for you, Joanna, if you wanted to see those pieces. In general, though, what I would say is absolutely, parents are appropriately cautious in terms of moving forward and looking at information, and they've had a lot of time now to look at the information that we do have around vaccination and the vaccines that are effective for COVID-19 that we have on hand. We've seen really good uptake by our 12 to 17-year-old age group people, and very much been encouraging parents to get the information they need. The school boards have been great about getting information out to parents as well, and then talking through the issues in the home and promoting those sorts of things. So I think as we go forward and we move through this process with the vaccines hopefully being approved for kids in this 5 to 11 age group anyway, before the end of this year, that what we'll see actually is, again, some really good uptake as we go forward, just as we've seen in that next oldest age group. So I'm quite hopeful that that's going to be the case. We do see overall, when we look at vaccine coverage in Hamilton, at all of the rest of our vaccines that we collect information on, that we have good vaccine coverage right across the board, and hesitancy is actually quite low. So I think as we move through it, people will ask good questions and then move forward and make a good decision for themselves and their child.
Thanks. And my next question is also for you, Dr. Richardson. SCARS in forecasting predicted sort of the fourth wave in Hamilton around mid-October, but we aren't really seeing cases rising at the moment, unless I'm wrong. Do you have an idea what's sort of holding back the cases from increasing, or do you kind of have an idea of what we can expect over the next couple of weeks? Like, can you talk a bit more about sort of that forecast and how that relates to what we're seeing now?
Yeah, absolutely, Joanna. As I said at the beginning of my comments today, when you look at what we had sent to the Board of Health just a week or so ago around our scores and forecasting, and as well what the Ontario Science Table had put out just last week on the forecasting, it's really a delicate time, a fragile time, a complex time, depending on which of our epidemiologists you speak to. Just talking about the fact that we have a number of different things that are going on, right? We have that Delta variant that is out there and is quite transmissible and can cause quite severe disease. We also have increasing vaccination rates. At the same time, people have been, pretty good about their public health measures in lots of settings, as we're seeing. We're hearing from our schools, things are going well there. And we are also knowing that people are going to be coming back indoors more and more. And so that increases the possibility for transmission. So it's a challenging time to make forecasts as we go through this period of time. Our rates have just been sort of fluctuating around that 40 to 50 sort of mark over the last little while, that 40 to 50 per 100,000 population. And so they go up for a short period, they come down for a short period. So no real trend over the last few days, other than it continuing on and us continuing to see the outbreaks that we talked about earlier. So we'll continue to watch it. Our epidemiologists will continue to work on forecasting and what we know and monitoring things as we continue to do the case and contact management. But that's what's absolutely key. Get those vaccination rates up. Be mindful as you come indoors. Use those public health measures. We need to continue that to keep those rates low.
Thank you, Dr. Richardson. We have a bit more time, so we'll go through for one more question each. We'll go back first to Lisa Polesky. Lisa, if you'd like another question, you can go ahead.
Hi, thanks very much for the additional question. This would be for Dr. Richardson. So we heard my colleague was listening in on the Haldeman public health briefing this morning, and the acting MOH there said he was investigating increases in other diseases that are pushed aside because of the COVID-19 response, particularly Lyme disease and West Nile. Just wondering what you've seen specifically in Hamilton, or is it hard to know? Because I know we also heard in Board of Health how a lot of the resources for other parts of public health have had to be redeployed during COVID. So just wondering what you've seen for like those other viruses.
Yeah, thanks, Lisa. And thanks for reminding us all that there are many other things going on other than COVID-19. It's certainly a situation we're very mindful of as a public health leadership team and our Board of Health, talking about the other things, the other needs that are out there, and whether those are communicable diseases like the ones that you talked about, or whether they're issues like addictions and mental health, or other vaccines that we'd like to see at higher rates, getting out and doing other inspections that we know are very important to do. There is a lot of really important work that we'd really like to be able to spend more time and energy on in order to benefit our community. And we know that's the case right across the healthcare system. You see that all the way through. So We have seen some increases in some things. We've had some increases, for example, in sexually transmitted infections and the number of calls that we're getting through to those phone lines and into our clinics with people interested in coming in there. We can take a look, Lisa, and see if there's anything else in particular to flag at this time. Certainly, we do monitor the trends. Continuing to do communicable disease control is something that is one of our highest priority items. So they are on it and doing that work. Our outbreaks have been nice and low because all these public health measures don't just stop transmission of COVID, they do stop transmission of other viruses in settings. So that work has actually all been much lower than usual. But if there's anything else when we take another look at it, we'll get back to you, Lisa.
Thanks.
We'll go next to Bobby. Bobby, if you'd like another question, you can go ahead.
I would love another question. The more questions, the better. This is for Mr. Thorne. Going back to that Saturday event there near McMaster, you mentioned that there's a high priority on parties right now. Do we know how many parties are being investigated or approached by bylaw officers and what fines or orders they might face? And I also wonder if, given what happened on Saturday, is it too little too late for bylaw to put in any sort of orders at this point?
So thanks for the question, and a couple of parts to that. So the infraction does relate to typically what we've seen is exceeding the capacity for social gatherings, whether indoor or outdoor. And so no, certainly not too little too late. And in fact, that enforcement did start happening a number of weeks ago. So bylaw has been out to house parties in the past, has issued charges in the past. I don't have an exact number for you in terms of how many were specifically student house parties. But there have been charges against them over the past couple of weeks. And that is part of our regular enforcement activities, particularly focused on weekend enforcement right now, that we are proactively going out to some of these areas where we know there have been student parties or gatherings that are exceeding those limits. And that's been happening for the past few weeks, and it's going to continue to happen for the next few weekends as we know these types of activities are occurring. We're both responding to complaints in some cases where neighbors or members of the public are letting us know that these activities are happening. We also know some of the hotspot areas, and we're going out to those spots proactively. So this has been something that's been ongoing for a few weeks now. It has, as I said, resulted in some charges already. I hope that we've seen the last of it, but we're going to be continuing to go out every weekend and enforce and be issuing charges whenever if those events exceed the gathering limits.
Thank you.
Thanks, Jason. We'll go back to Emily from CHCH. Emily, if you'd like another question, you can go ahead.
I'm actually okay for now. Thank you.
Great, thank you. We'll go next to Fallon Hewitt. Fallon, if you'd like another question, you can go ahead.
Thank you. This is kind of just, let me find my question, sorry. No, this was a question about the different charges that are laid by the city. So some of them are obviously ROA charges, but then others are the masking bylaw, and some even this week were the physical distancing bylaw, which I haven't often seen used. Most of them have been ROA this whole time, but why do some charges fall under one, but like not the other, even if they're like a similar offense? Jason, I don't know if you could tell me more about how those are sort of decided or how they're categorized. I'm just curious.
Yeah, so we do have, you're right, there are different types of requirements. Some are the provincial ROA requirements. Some of them are the city's own bylaw requirements. For example, our masking bylaw. So the officers do use their discretion when they're in the field in terms of what the infraction is and what the appropriate charge is. So you will see a mix of both what we would call APS, administrative penalty system charges, which is typically the violations under the city bylaws, as well as the ROA, which are the provincial charges. The vaccine verification requirements, that is one of the provincial requirements. So those, as you see those, will be appearing as ROA charges. But the same enforcement team is also when they're out. So for example, in some of the house parties that we visit, sometimes what they're enforcing is actually a noise bylaw complaint. So, the party may or may not be exceeding the gathering limits, but it could be in violation of the noise bylaw. So the same officers do continue to enforce some of those very long-standing city bylaws as well when they're out doing their enforcement activities.
Great, thank you, Jason. We'll go back to Katrina from the Hamilton Spectator. Katrina, if you'd like another question, you can go ahead.
Thanks. This question is for the mayor. I'm just curious to know if you have thoughts on the McMaster party from the weekend, if there's anything you wanted to say.
Very disappointed in the whole affair, quite frankly. You know, you have to be living under a rock to not understand and appreciate that getting together in this kind of scale is potentially going to spread a virus, not only to themselves, but whoever they carry it back to. So, you know, I think better of our youth, and certainly those that are going for higher education ought to know better. At the same time, you know, some of the hooliganism that occurred is over the top as well, and you know, nothing justifies that kind of activity. And that, you know what, you've put that many people together with alcohol, you know, good things are not likely going to happen, and that's certainly been the case in this particular instance. So, I really encourage the police to level all appropriate charges as they can. I do respect the fact that, you know, when you've got a crowd of this size, weighing in with bylaw enforcement and police in a very aggressive way can actually exacerbate the problem and potentially cause a riot, you know, especially when people are not in their right mind. So I do appreciate the sensitivity in which they dealt with this. And then, you know, after the fact, I'm sure there's going to be charges and maybe more charges. And I would think that these students may very well have a brief, if they are in fact students of McMaster, that they will have a brief visit to McMaster. I can only imagine that their code of conduct would certainly not involve turning over cars, entering other people's homes, vandalizing and or throwing beer and can bottles into a crowd, crashing onto people's heads and causing them to go to the hospital. So you know what, I imagine their expulsion for them is probably something that could very well likely happen, and that's a life-changing circumstance. And you know, people have to know that their actions have consequences, and the consequences in this particular case are not going to be particularly good.
Thank you, Mr. Mayor. And finally, we'll go back to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the extra question. My question's for Dr. Richardson. Dr. Richardson, the Registered Nurses Association of Ontario and the Ontario Hospital Association are calling on the province to expand vaccine staff mandates for hospitals the same way that they recently have for long-term care. I'm looking to find out where you stand on this. You know, does this work, and would you like to see this expansion to other healthcare settings such as hospitals?
Thanks, Joanna. Yes, of course, you know, and we've seen the impacts that these can have in terms of these vaccine mandates, and looking at where others are going with them in other jurisdictions. It's definitely something that we're interested in and continue to pursue, and having the province continue to pursue. I think that provincial approach is really key, so that there is a level playing field across the whole province rather than doing it sort of area by area. And then, you know, I think as the OHA pointed out, in terms of looking at all of healthcare as they go forward, because otherwise we know that can make it sort of tricky as people are looking at one place or another as they go forward with their employment. So I think that sort of uniform approach as well is very helpful, both from the standpoint of protecting the people who are in those settings, and starting first, as the province has done, in looking at the highest risk settings and then move down through them, especially as they see how effective a given policy measure is, and then moving forward. Those are all good things, and we need to continue down that road.
Great, thank you, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today, so I will pass things back to you.
Thank you very much, Jasmine, and thank you to Cable 14 and Clear Cable and our media partners for your ongoing good work to ensure that this information gets shared with the public at large. It's very, very important, and we very much appreciate it. For more information on COVID-19 and the financial supports that are still in place, many of them are still able to get accessed. And for any of those updates, visit our website at hamilton.ca/coronavirus. And please continue to follow all public health measures to get your vaccine. You know, I'm listening to Jason explain that not only do you need to have someone at the door in a restaurant to verify a vaccine, which I've done on several occasions, and it's very quick and very easy for those that are taking part in that. One also asks to take phone numbers and names as per usual, so that if any kind of caseload comes out of any location, that quick contact tracing can begin. It's so very important that those previous requirements are still very much in place, and you're required to follow through on those. You can continue to find information on our city's website regarding the coronavirus. So www.hamilton.ca/coronavirus and/or hamilton.ca/get-your-vaccine. All are sites where you can get information around how you can get your vaccine quickly, conveniently, easily in our community right now with no limits on supply, and you still have a choice of Pfizer or Moderna. And so please avail yourselves of that vaccine. It really is the path forward for us to get past this pandemic. So thank you for all your effort out there. Good news that the vast majority of you have done and continue to do the right thing, and we really appreciate that. And we hope and pray that others will fall in line. Thank you all very much, and we'll see you next time in a couple of weeks.